फ्लोर देने से पहले मैं चाहूँगा कि हम जो है सूरह फातिहा पढ़ लें। हमारे जो वेरी ओन हबीबियंस और जो हमारे हबीब स्कूल के मैनेजमेंट से रिलेटेड डॉक्टर अली सुलेमान हबीब साहब, जिनका हाल ही में इंतकाल हुआ। इसी तरीके से सैयद शबीर हसन बिलग्रामी साहब जो प्रिंसिपल थे, उनका इंतकाल हुआ, वो भी हमसे रुखसत हुए कुछ दिन पहले। और सैयद नकी अख्तर साहब जो है टीचर थे, वो रुखसत हुए। इसके साथ साथ आप तमाम जो मरहूमीन हैं अपने, उनको भी इस सूरह फातिहा में शामिल कर दिया। बिस्मिल्लाह। थैंक यू। फॉर्मेट में इसका आपसे शेयर कर लेता हूँ। हमारे पास दो स्पीकर्स हैं। हम पहले डॉक्टर साद खालिद नियाज साहब को रिक्वेस्ट करेंगे कि वो 15 मिनट इस सब्जेक्ट के ऊपर बात करें, कोरोना वायरस और पाकिस्तान। हाउ आर वी प्रिपेयर्ड और वी आर नॉट प्रिपेयर्ड, व्हाट इज happening, what is going to happen. Dr. Saad will discuss these aspects. And second speaker is Dr. Shahid Hafiz Kardar Sahab. वो इकोनॉमिक इम्पैक्ट जो है इसका, जो पाकिस्तान पे हो रहा है या होने वाला है, और आगे आने वाला बजट किस तरह का होगा, वो उसके बारे में अपने व्यूज शेयर करेंगे हमसे। जब ये दोनों प्रेजेंट अपने व्यूज शेयर कर लेंगे, वी विल हैव अ क्वेश्चन आंसर सेशन एंड देन अ रैप अप टाइम फॉर ईच स्पीकर फॉर 2 minutes, and inshallah by 5:30 or so we will end this Zoom meeting. So before I invite Dr. Saad Khalid Niaz, I'd like to share a very interesting fact that both of the speakers today are from Red House, और जिन्होंने ये Zoom platform हमारे लिए facilitate किया है, Harun साहब, he is also from Red House. So all the speakers and the facilitator are from Red House. Uh, Dr. Saad Khalid Niaz does not need any introduction. He passed out from during the year 1976, my birth year, and he is a very eminent and distinguished doctor, not only in Pakistan in his field, but he is recognized worldwide. इनके बारे में मशहूर है कि इन्होंने 25,000 से ज़्यादा बेसिक प्रोसीजर्स किए हैं, जिसमें कोरोनोस्कोपी है, एंडोस्कोपिक है, और बहुत सारी चीज़ें हैं। कैंसर रिलेटेड इश्यूज पे भी बहुत सारा हो रखते हैं। और आजकल जो कोरोना वायरस रिलेटेड जो भी प्रॉब्लम्स हैं, डॉक्टर साद खालिद नियाज एंड हिज टीम आर एट द फोर फ्रंट ऑफ एवरीथिंग. So without further ado, let me invite Dr. Saad Khalid Niaz. Sir, thank you very much. Please, you can start.
Rabbi shrah li sadri yassir li amri wahlul min lisani yafqahu qawli. Bismillahirrahmanirrahim. First of all, I'd like to thank the organizers and the people behind this who have given this opportunity. I think a lot of people listening to this talk probably know more about COVID-19 or SARS-CoV-2 than maybe I do, because this is one instance where the social media is full of some right and some baseless things that are circulating, like it is for so many other things in our life. But obviously this has completely changed the world. Nobody ever thought 6 months ago that we would be doing this Zoom based discussion on an illness where a clinician or a medical specialist will be sitting with an economist and discussing the effects, both medical and economical effects of that in the society. So what my own view was that I'm going to keep this talk very limited and more hit at the myths, at the misconceptions that we feel are actually spreading. And then I want to just touch a little bit on the current issue that is in Pakistan, which is about the lockdown, yes or no, and how is it going to affect it, and is the disease really affecting Pakistanis as much as the rest of the world, and if not, then or is it going to affect us later on? So we all know that most of you, if not all, this is a coronavirus, and there are 7 coronaviruses that are known to have affected human beings, and this is one of them. This is not a complete part because it's just an RNA virus, so it needs to get into into a host cell for it to work, for it to multiply. By itself, it cannot do it, and so now, what happens when it enters your body? Basically, when it enters, mostly it enters through your respiratory system. So that is why this touching and washing hands. And respiratory system is through your mouth and nose. So that is why there is so much emphasis, and maybe a little bit with the eyes as well. So that is why washing hands becomes imperative, because once you wash your hands, you wash the virus, and it's not going to affect you, even if you've got it on your hands. And it can be given to us by anybody who's got it, through his secretions, through his touches. So we all have this habit of touching our face, which you cannot stop. This is natural. And no matter how much you try, you cannot. Most of us will end up touching some part of our face, and that's how it goes on to the hands, and then it goes to the other part, different things that we have touched. And so hand washing becomes very, very important. Similarly, because the virus cannot travel itself, so if you are keeping yourself away, you are going to save yourself. And that is why distancing becomes important. So washing hand, distancing. Now, what about other things that we have? Like if you're sitting and talking to somebody in the clinic with a doctor, we have a big problem. People don't want to go and see doctors because they're worried they might get it. If you are at a certain distance from the doctor or another person, you're not going to get it. But if you wear a mask, then if the person actually ends up coughing or ends up having... Can you hear me?
Yes.
Yeah. So if the mask actually prevents you from getting that cough ki wajah se, the secretions that come through the cough, and so if you're wearing a mask and maintaining distance, you can save yourself. So we start with the saving, because I think that's all we have for this virus. There are some myths that we have which I need to address. Number one, does it only affect elderly people? No. Does it only affect people who've got diabetes, hypertension, liver disease, kidney disease, cancer, immunosuppressive disorders? They are more likely to be affected, more likely to have harmful effects because of this virus, but it surely affects people who don't have any problem at all. And we have loads of examples of doctors who are unfortunately died, who have unfortunately died in the UK, who also happen to be of the Asian background. So this myth about BCG and other things that we have here does not really apply, because looking at the number of deaths in UK of the Asian doctors, actually, because almost all of them are BCG vaccinated, so it's actually not that. And so are we protected because of the immunity and all that we have? Not really sure. We don't know. Yes, we are less affected, but why, we don't really understand. There are speculations, there are theories, but nothing that is concrete has come up really. The other thing that is circulating a lot is that this virus is human made, and so far we have no medical evidence that this virus has been manufactured or made in China or America or wherever. Because of the composition or the way the virus is made, it's very unlikely that this is a human-made virus. This is based on what the experts in virology say. The other concept that we have is that, we need to have this herd immunity so that everybody gets it and nobody will be affected, or very few people will be affected. And I don't think that actually has been tested so far for this virus. And some of the questions that we don't have answers to is, when I get an infection of COVID-19, how, and I clear it off. I'm one of those who lucky ones who clear it off. How am I protected for life? Am I protected for 3 months, or am I protected for 1 year? After I've had an infection, can I get this infection again or not? These answers we don't have, and until we don't have these answers, we really don't know what kind of immunity the community is going to have. So again, this is one of the issues. I mean, these are points that have been discussed a lot of times when I'm sitting with my non-medical colleagues, and even in the medical circle, we are discussing a lot about these things. So what is peculiar about this virus? Why are we, we did a press conference 2 weeks ago when our numbers shot up by 40%. So we were concerned, and there was this Ramzan was starting, and we were really concerned that, Ramzan is along with Ibadat, it's also a festive month where people tend to meet, iftars, etc. And so we were really concerned, and the government wasn't sure. So at that time, we had 9,000 cases, approximately 9,700 cases. Now today, almost 2 weeks from that 22nd April, we have over 27,000 cases. We had 100 and some deaths, and now we have over 600 deaths. So to assume that, Pakistan and Pakistanis are safe, the virus is really not affecting us, and the lockdown is actually causing a lot of issues, which is absolutely correct. But what we fail to actually include in this whole argument is the fact that none of the other disease actually affect the doctors, medical staff, nurses, technicians who are looking after these patients. So, for example, in my one ward, I had one patient referred in civil hospital from one ward who had totally different disease. We did an endoscopy on that patient because bile duct was obstructed, and the patient was critically ill. And 6 hours later, the patient actually had chest problems, and next day we found out that the patient was actually COVID-19 positive. Now, that one patient actually, because the initial ward that had sent the patient to us did not know, and he had no other symptoms that would suggest, we had to actually quarantine the entire staff looking after him in that ward. Then our own ward, our endoscopy suite, our HDU, just from one patient, 2 wards were practically stopped from working. We had over 40 people from the medical staff who had to be quarantined. And this is unique about this virus, which makes the healthcare workers very, very uncomfortable, because every patient has can actually put a department off. And so this is why this is a big problem for the healthcare workers. Now, the other problem with mixing around is that, yes, you can open your shops and stores and everything else, but what makes you so confident that you're not going to go home and pass that virus that you've acquired or got from someone during your shopping thing, office work or whatever, to your parents, to your loved ones at home? While you people are less likely to be exposed, it's a big problem for the healthcare workers, because we obviously feel very uncomfortable coming back home, especially those who've got young children, who are pregnant, who've got elderly parents and family. So all this makes the management of this virus even more difficult for us. Now, let me talk a little bit about how we see Pakistan. As I mentioned, when we actually did the first press conference alarming the government and warning the government to take actions, because they had come out with these SOPs, especially with the religious ulamas as well, and they had also done these SOPs with the business community. And our problem was that we could see that the numbers had suddenly risen. And we said, well, let's wait for 2 weeks, because everybody was saying, 2 to 4 weeks, we will know whether we are going up or not, up or down. And very interestingly, day before yesterday, when the Prime Minister actually and his cabinet or people around him did the conference, they said that yes, the numbers are rising, yes, but because of the way our economic situation is, we have to actually ease off the lockdown. Totally contrary to what they had been saying before. Now, if this virus gets out of hand, what are the issues? Why are we worried? While we're looking at economy, which is not my subject, my problem is that in Karachi, according to the government statistics, we have 95 critical beds, 95 critical beds for COVID-19. That's all. They are in Aga Khan Hospital, in Dow University, in Indus Hospital, in Jinnah Hospital, and SIUT currently. Civil Hospital also has beds, but very, this ICU is not really equipped fully. Now, when the civil hospital ICU was only commissioned and not even started, not even close to starting, on the government numbers and figures, they already included that. So when the government is sharing figures with us about numbers, there are two problems. One, they're including the isolation beds, which are basically for normal people who are positive for COVID so that they can't spread it to anyone. They have been, those are the beds that are not medical beds. They are actually included in the whole pool that we have. We actually emphasize on the critical care bed because critical care beds, we are full. Last 3 days ago, when we sat down, when the government did this press conference, on that day, we had 90% of our critical care for COVID-19 full in Karachi. This is Karachi. We are not talking about the smaller cities and the cities that don't have facilities. On top of that, the big problem is lack of organization. So we are short of staff. We have lack of organization. There is no one person who knows how many beds we have currently available. I can challenge you to pick up the phone and ask the Chief Minister Sindh and tell him, mujhe bataye, how many beds do we have and where can I send my patient who seriously needs a critical care bed or a ventilator. So lack of organization, lack of expertise, lack of technical support, lack of equipment, all this, and here we are easing off the lockdown. And when well, let's hope I'm wrong, and I always pray that I'm wrong, and we are all wrong who think that this might become a problem for us. If this thing after easing off the lockdown increases to maybe, tenfold, that's all. We don't have the capacity to handle patients. And what will happen is you and I will end up being admitted in regular wards with COVID-19. And when that happens, all our hospitals will become COVID-19. So when you go to a hospital with an appendix or with something else, or your loved ones and dear ones go to a hospital, they are going to be lying next to a COVID-19 patient because our facilities currently that have been allocated for this problem are very, very limited. So that is one of the issues we on the medical side have with the government. We are saying that while you want to ease off the lockdown, please tell us what you have done on this side. Don't tell us about the isolation center in Expo has got 600 beds. That means it's like 600 rooms in houses in Karachi. That doesn't mean anything. What we are talking about is medical facilities. Lastly, do we have any cure for this problem? We have heard plasma exchange, and Dr. Tahir Shamsi keeps on coming on television and telling us how great that treatment is. With due respect, that has yet to be shown to be effective in a proper trial, and that is why the rest of the world, along with Pakistan, is actually doing that in a trial situation whereby we may find out in a few weeks that yes, it's few months, that this is an effective treatment. Similarly, there was a big thing about Dow University of Health Sciences coming up with antibody separation, and again, that is far from being, it's not even started the phase 1 trial, so really we don't know. Chloroquine it shot up like anything, and it seems to have gone down now. So really speaking, the treatment for COVID-19 is for those who are badly affected or severely affected is to treat their chest, depending on and what is found, whether it's ventilation or otherwise, support the kidneys, support the chest, and it's basically supportive treatment. Now, one last thing, one of the issues I had, and I would like, others to obviously, especially my next speaker, to talk about this, is that Ramadan is not the most productive month for Muslims. And one of the points we raised was, why go for an ease when you're actually at lowest in terms of your productive value? The only thing that's going to get better is probably Eid shopping and listening to the Prime Minister and the government. People don't have money for that anyway. So is this the best?
Your voice is muted, Dr. Yeah.
Am I almost there?
Yeah, and your time is almost up, so you need to close.
Just last
sure.
2 lines. That's it.
Sure.
One of the things that we have highlighted is that it's not easy for the doctors to wear all those gears and to work in Ramadan, especially in the last 10 days. And those were the points that I wanted to share. I would be happy to take any questions later on. Thank you.
Thank you, Dr. for summarizing or putting it so many information in such a short span of time. We are very thankful to you. Before I go to my next speaker, I'd like to acknowledge Mr. and Mrs. Muslim Habib, who are here on the Zoom meeting. And I would also like to acknowledge Principal Andy Shehzad from Habib Public School. Thank you very much for being here. Now we have to go to our next speaker, Dr. Shahid Hafiz Kardar, son of former Captain Abdul Hafiz Kardar from Red House, passed in 1969, has been the 16th Governor State Bank of Pakistan, has been a provincial finance minister. He has been holding very important positions in government, and he's been a leading economist. He would explain us the effects of what Corona has brought for Pakistan. Is it good? Is it a blessing in disguise? Is it something that we should be afraid of moving forward? Because Pakistan is one of a developing country, and we are in IMF program also, and budget is at the head. So over to you, Dr. Shahid Kardar. I hope you have 15 minutes to just speak, and then we can take the questions and answers. Thank you, sir.
पहली बात तो ये है कि आपने मेरी माजी की बातें ना किया करो, मुझे शर्म आती है.
So you are.
मैं स्टेट बैंक में था, फलां था. I have enough skeletons in my cupboard to be reminded of them. डॉक्टर खालिद नियाज़ को मैंने सिर्फ 2 बातें कहनी है कि जी I'm one of those जिसको WhatsApp की वजह से PhD मिली हुई है on Corona. So I am another expert on Corona thanks to WhatsApp, जैसे आप कह रहे हैं. But I found one comment of his interesting and amusing from the Pakistani context. Before I come to my, उन्होंने कहा जी रमजान में हम अपनी lowest productive self होती है. अच्छा मुझे बाकी साल का, मुझे बाकी साल पे भी शक है कि हम कितने productive होते हैं. उनको सिर्फ रमजान की फिक्र है. I'm more worried about us Pakistanis being productive generally, let alone just Ramadan. Actually, ये जो हुआ है, let's try and understand कि हमारे यहाँ हुआ और उसका impact देखें. A lot of people were actually participating in this are people with background in commerce or in industry, किसी ना किसी किस्म का कारोबार कर रहे होंगे, या holding senior positions in organizations which are actually somehow linked with the economic activity. 2-3 चीजें मेरा ख्याल है जो समझने वाली बड़ी जरूरी हुई हैं. एक तो ये कि ये सिर्फ हमारे यहाँ नहीं हो रहा, जो हुआ है in terms of what is happening to the economy, it's global. And the global aspect obviously has hit us. Globally, the world is frankly the kind of recession that we keep hearing. Europe itself, for instance, would actually contract by almost 8 percentage points of GDP. तो हमारा भी इसका impact आता. हमारे यहाँ थोड़ा सा फर्क ये है कि unlike the discussion in this country, which is more about the export sector, because it gets a lot of publicity, a lot of press coverage, the reality is that it only is 11% of Pakistan's GDP. So it's really the domestic economy which is far more important in terms of creating the kind of livelihoods that we is one of the areas of concern. अच्छा हुआ क्या है? I mean, in the sense of what has happened is that because demand has been contracting globally, so first of all, our exports have been affected. So, and when exports have been affected, so local demand भी affect हुई है. हमारे यहाँ दो तीन चीजें साथ उसके हो गई. One was this impact of remittances. Pakistanis बाहर थे. A major component of what comes to Pakistan, which actually creates a demand for goods and services जो पाकिस्तान में produce होती हैं, is really from the point of view of remittances. अब contraction and demand for two other reasons भी हुई, और जिसकी वजह से अगर डिमांड कम होती है तो आप जो कारोबारी है वो उस तरह की चीजें तो नहीं बनाएगा ना. सो हमारे यहाँ क्या हुआ है, आप अपने आप को खुद देखें. आप हजरात और मैं अपने घर पे बैठे हैं, हमारा पेट्रोल का खर्चे को क्या हुआ है, और अगर मैं बाहर नहीं जा रहा तो नॉन फूड खर्चा भी मेरा कम हो गया. सो आई एम नॉट क्रिएटिंग दैट डिमांड. जस्ट लुक एट योर ओन, to begin with, non-food expenditure. If you look at your food expenditure as well, जो आप पहले exotic खाने की यार यहाँ वहाँ से मंगा लेते हैं, वहाँ जाके खाने वो भी कम हो गया. So even the food expenditure is actually taken a very different form in terms of an element of contraction which has come in. So if there is a contraction of demand for goods and services, हुआ क्या? आपके सामने लॉकडाउन की वजह से मेरी डिमांड कम हुई है. There has been what you and also call precautionary savings. यार इन हालात में should we have a small set of savings? खुदा न खास्ता कुछ हो ना जाए. अच्छा, जब मैंने और आपने अपने चीजें खरीदने कम की हैं तो क्या हुआ है? कारोबार अफेक्ट हुए. अच्छा, जब कारोबार अफेक्ट हुए, वो अपनी चीजें नहीं बेच, सबसे पहले उसने क्या किया? The fastest way you need to cut costs is frankly to ease out staff. That's a fact of life. And when you ease out staff क्या होता है? जो आपने employees को कम किया, and employee is also a consumer, right? So there is a collapse of demand also taking place because workers have lost their jobs. So this contraction of demand that is taking place also means कि जो आदमी कारोबार करता है is not likely to put in that kind of investment in expansion of the karobar. ये भी obvious है, ठीक? So now expansion होनी है ना. So one of the problems I have with the State Bank, which I generally don't talk about, but आपस में बात हो रही है, वो ये है कि when you are economy की demand के दो impact components होते हैं. एक private sector की demand, and the private sector demand is private sector investment and private sector consumption. मैंने दोनों आपको दिखा दिए कि जी मेरी और आपकी डिमांड कम हुई है. So that contraction is taking place on the consumption side. Investment side, इन हालात में मैं इन्वेस्टमेंट तो करने से रहा, और इसलिए मुझे हंसी आती है जब कंस्ट्रक्शन सेक्टर की बात हो रही है कि भाई मेरे कमर्शियल स्पेस कोई भागा हुआ आ रहा है. खाड़ी वाला कह रहा है मैंने दो मॉल्स में और दुकानें खोल ली. गुल अहमद आके कह रहा है मैंने 2 आइडियाज की दुकानें खोल ली. So that demand frankly is also impacting on the investment. So if you look at the private sector aspect of demand, तो वो कम हुई है. The government demand was being squeezed or strangled by the IMF project. So in other words, while the contraction of demand is taking place, the fear कि जी interest rate बढ़ा के रखना है क्योंकि inflation ज़्यादा है, inflation is not going to take place. Agar demand is not going to be there, inflation is not going to be anywhere near what the State Bank thinks. वो तो गलत बात है ना कि वो interest rates high रखे हुए हैं कि वो जो बाहर से पैसे आए हुए हैं, hot money जिसको हम सारे कहते हैं, वो भाग जाएंगे. वो तो वैसे भी चले गए हैं यार, सिर्फ 800 मिलियन रह गया. वो भी इसी वजह से रह गया कि आपने 9% दिया हुआ है. मैं देखता हूँ थोड़ा सा हालात की वजह से आपको कम करना पड़ेगा, उस पर कोई दो राय है नहीं. So what am I saying? I'm saying, look, some of the problems are being created by our own decisions, despite the fact that the world has changed and the economy has collapsed And some of the policies which we are taking, frankly, will not make enough of a difference from the point of view of what you require. जिस तरह इस वक्त टेम्परेरी अनएम्प्लॉयमेंट है या कुछ परमानेंट अनएम्प्लॉयमेंट हो जाएगी, मुझे नहीं पता कितने कारोबार बाकी जिंदा रह सकेंगे। हमारे यहाँ ये अभी भी आज भी मेरे साथ कोई बहस कर रहा था कि यार इनके पास रिजर्व नहीं है। पता नहीं, मतलब मैं हैरान होता हूँ, समझदार लोग ऐसे समझते हैं कि अगर मेरा कुछ प्रॉफिट है तो वो कैश की सूरत में गाँव तकिए के नीचे मैंने रखा हुआ है या बिस्तरे के नीचे रखा हुआ है। Somehow they don't understand that profits are actually invested in assets, which is machinery or some other form. Cash किसी के पास नहीं पड़ा। And there is now a dash for cash. The liquidity is a key constraint. And you don't provide that liquidity quickly enough, which will also include printing of money for the government. ये fact है। अब ये रोना कि जी inflation होगी, पहली बात ये कि मैंने आपको कहा inflation नहीं होगी। Second, printing of money, frankly, is money coming from one pocket of government to another pocket of government. इससे कोई impact नहीं होता in terms of what happens to government. So ये जो हम ज़हन में रखा हुआ है कि जी पता नहीं कल आएगी या नहीं आएगी, हम जन्नत में पहुंचेंगे या नहीं पहुंचेंगे, this frankly is a matter of survival. A lot of the, and if some of the frankly businesses close down, some of them may never be able to recover. And this whole belief कि जी आपके पास reserves है, cash है, मेरा ख्याल अभी तक किसी को बात की समझ नहीं आई. And just get, and you will, और ये जो है ना पहले शुरू हुआ था कि जी मैंने आपको लोन दे दिया 3%, मेरा कारोबार मान रहा, तुम कह रहे हो मैं तुम्हें लोन दे देता हूँ, so I pick up another liability और इंटरेस्ट भी दूंगा उस पर. So this whole clarity, आप अगर चाहते हैं कि ये कुछ होगा तो frankly a lot of it will have to be in the form as a component, will have to be not just zero interest rates but also as a grant component. जो अब गवर्नमेंट कह रही है कि अच्छा जी कुछ रिस्क हम लेने को तैयार हैं, ठीक. Let me now come to the other problem, which is the coming budget. देखिए IMF वो उनके ज़हन में भी अभी यही है कि जून के बाद इंशाल्लाह हालात तब्दील हो जाएंगे, हम सारे अच्छे बच्चे आएंगे, अच्छा बच्चा फिर अच्छे काम करने शुरू हो जाएगा और फिर हम सारे के सारे इंशाल्लाह जन्नत में पहुंच जाएंगे और सब चीजें बहुत अच्छी हो जाएंगी. They continue to believe that next year, और ये मेरा ख्याल है जो उनके projections हैं very optimistic. मेरा ख्याल है part of the reason is ये जो 1.4 billion roughly दिया गया है, उसकी भी एक just
there is some disturbance. शायद साहब की आवाज चली गई. आप शायद साहब आपको आवाज आ रही है? I think there is a connection problem. Shahid Saab ka. I think he has left and we will join him as soon as he is in. So I guess if there is a connection problem, we can start the questions and answers. And before we do, I'd like to welcome Mr. Kumail Habib Saab also to this meeting. And we can wait for 5 to 10 seconds for Shahid Saab to join back. Otherwise, we can go straight to the questions without wasting any further time. I think he's on the call. Let me just take his call. Assalamu alaikum.
I have a question for Saad. Please let me know if this virus is aerosol.
Hello.
Yeah, I hear you.
Okay.
Sir, can we wait for a minute so that Dr.
Yeah.
Hafiz can join Shahid Saab?
शाहिद साहब
Harun
को
Saab,
complete
he
कर लेते
can.
ना क्या?
Harun Saab, he cannot join back. वो कह रहे हैं link unreachable. Can you please look into that? Thank you. I also acknowledge the presence of my dear friend Asfar Hassan from Nutshell Forum. He is a very dear friend of mine and has been organizing conferences worldwide. And there are questions from his side also, so we'll take up those questions as soon as we are on the question answer session. Thank you, Asfar, for joining us. So, जो बात अभी डॉक्टर साहब कर रहे थे उससे रिलेटेड, बजट से रिलेटेड और इकोनॉमी से रिलेटेड, आई नो कि दिस इज नाउ अ न्यू नॉर्मल and a lot of things I think he's joining back. Yeah, he's joining back. So let's just go back straight to him. Can you hear us, Shahid sir? You need to turn off mute. खत्म करना पड़ेगा सर आपको.
जी मैं कर लिया.
Yeah.
I'm sorry.
So let's resume.
I'm sorry. Anyway, I was talking about the IMF.
Yes, the budget and the IMF, sir.
Optimistic projections दिखा दी हैं to justify the 1.4 billion जो उनके बोर्ड ने अप्रूव किए. वो भी after all, let us never forget कि उनके यहाँ भी वो इंसान है ना, कि भाई मैं आई एम एन एम्प्लॉई, मैंने बड़े साहब को जाके दिखाना है कि जी जो मैं आपको बता रहा हूँ उसकी वजह से सब चीजें ठीक हो जाएंगी, आप इनको दे दें. और उसकी वजह यह है कि मैंने एक प्रोग्राम साइन किया. अगर वो 3 महीने बाद मैं जाके कहूँ सर ये प्रोग्राम नहीं चलेगा, तो वो पूछेगा कि यार तुमने ये क्या प्रोग्राम बनाया था, जरा मुझे समझाओगे, 3 महीने पहले तो तुम कह रहे थे सब ठीक है. So there is also that aspect which we take very lightly. There are human beings involved whose career paths are involved, who also have to justify a certain thing, and they created frankly a program which should never have been designed the way it was, to justify कि जी पिछला प्रोग्राम इसलिए ठीक नहीं चला था कि ये बच्चा बड़ा बिगड़ा हुआ है, इसको हमने ठीक करना है और अब हमने इसको ठीक कर दिया. और ये to go back and admit in 3 months later कि यार ये प्रोग्राम नहीं चल रहा. So now they are showing कि जी economy will grow at 2%, having said कि अगले साल 2% कि actually इस साल 1.5% की कमी हो जाएगी, without realizing कि इस साल ये जब जुलाई शुरू होगा उसके हमारे हिसाब से कम एक क्वार्टर will really be a real struggle for businesses to start their businesses all over again, frankly. और एक झगड़ा शुरू होगा around the budget time, उसमें मैं आता हूँ. So ये वाला जो इशू है कि जी हमारी ग्रोथ एकदम 2% अगले साल हो जाएगी, डिस्पाइट द फैक्ट के पीछे एक बैकलॉग आ रहा होगा. पहला क्वार्टर सबको याद है, तो आप लोग भी क्योंकि कारोबारी लोग हैं, बजट के बाद 2-3 महीने इसी में गुजर जाते हैं कि जी फलां चीज ठीक नहीं थी, बजट को उसको ठीक कर ले. So this whole business of whether the economy will actually recover at that pace is a big question mark. दूसरा वो कह रहे हैं कि जी exports will actually increase. हम कह रहे हैं, आपको मुझे बेहतर पता है, टेक्सटाइल से पूछ लें, किसी से पूछ लें, हम लेदर वालों से पूछ चुके हैं, स्पोर्ट्स गुड्स वालों से बात कर चुके हैं, टेक्सटाइल से बात कर चुके हैं, बोथ कराची, इस्लामाबाद, लाहौर एंड फैसलाबाद. We know that almost, and I'm being very optimistic, at least 50% of the capacity, frankly, is unutilized. And I'd be surprised, in fact, the numbers we have are higher capacity, unutilized capacity ki, but let's take the decision, take the view कि जी 50% capacity unutilized और हम कह रहे हैं आगे चल के 5%. To what extent will the world recover so quickly? मेरे पास माल पड़ा हुआ जो भी है is really for summer. Summer तो गुजर जाएगी by the time I'm actually going to supply to Europe even. And if you talk to some of the big boys in Faisalabad, मैं नाम नहीं लेना चाहता, two of the most respected names, easily the most respected name in the textile industry, एक ने 70% अपने स्टाफ निकाल दिया हुआ और एक ने कहा कि जी हमारी जो रिसीवेबल्स हैं, we are worried कि वो रिसीवेबल्स भी हमारा जो कस्टमर है will be filing for Chapter 11 bankruptcy, तो हमें नहीं पता क्या हो. So this whole increase of, in our opinion, exports is highly optimistic. Finally, ये कहा जा रहा है कि जी अगले साल we will raise revenues by 34%. अच्छा यार, ये तुमने अभी पिछले साल करके देख नहीं लिया? What lessons have we learned from what has happened so far? अच्छा वो सारे के सारे, वो देखो ना, मैं किसी तरह तो मैंने अपने आप को जस्टिफाई करना होता, तो एफबीआर को भी सूट करता है, मिनिस्ट्री ऑफ फाइनेंस को भी सूट करता है, IMF को भी सूट करता है कि जी ये सारा कुछ हो जाना था अब कोविड-19 ना आता. अल्लाह के बंदो, कोविड-19 सारा हमने कोविड-19 के खाते में डाल दिया. The reality is that they are actually showing a 34% increase in tax revenue. कह रहे हैं 5.1 ट्रिलियन हो जाएगा, which on a base of 3.8 या 3.9 is 1.2. वो कह रहे हैं 800, मैं कहता हूँ भाई एक्चुअल 1.2 आप दिखा रहे हो, वो 800 भी नहीं होने को तैयार.
So
last minute, I'll just end there. So a number of things will take the adjustment, the recovery, frankly, will take place far more slowly than we realize. We hope that the recovery is such कि जी वो थोड़ी सी durable हो जाए in about 4 to 5 months time. Thank you. I'll stop here.
Thank you very much, Shahid Saab. Without any wait or delay, we'll go straight to question answers. I've got 5-6 questions with me. Few are directed towards Dr. Saad and the rest are with Dr. Shahid. मैं Dr. Saad से related जो questions हैं, I'd just like to ask those questions. Dr. Saad, are you here with us?
Yes, I am.
So, the question is that there's a common question that all of us are asking these days, that should we get tested for coronavirus or not? And if we do, and if the result is negative, should we just go, okay, yaar, ab hum farig ho gaye, ab nothing is going to happen to us? So, I mean, this is something which is bothering a lot of us. And this question is from actually the facilitator of this entire session, Harun Kazim sir. So if you can answer this, I can go to the next question and then we can go further.
Okay, iske liye you need to just give me just a little time so I can explain. जो अभी जो टेस्ट होता है, दो किस्म के टेस्ट हैं. One is what we call the PCR based test, जिसमें आप वो देखते हैं कि वो जो है ना वो स्वैब लेते हैं from the nasopharynx यानी नाक के जरिए या गले के पीछे से जो सैंपल लेके फिर उसको एक PCR यानी वायरस की जो RNA है उसको देखते हैं. That is the most specific टेस्ट है इस वक्त. मसला उसके साथ ये कि 100 लोगों का टेस्ट करें तो 30 पॉसिबली नेगेटिव आते हैं जिनको होता है. मैं उनकी बात कर रहा हूँ. तो अगर आपका ये टेस्ट नेगेटिव आता है तो ये बात यकीन से नहीं की जा सकती कि आपको वायरस है या नहीं है. अगर पॉजिटिव आता है तो ये यकीन से कहा जा सकता है कि बिल्कुल आपको है, लेकिन नेगेटिव डजंट रूल इट आउट. नंबर 1. जो सीरोलॉजी के टेस्ट हैं, जो ब्लड टेस्ट के ऊपर आपने बहुत आजकल सोशल मीडिया पे भी बहुत चल रहा है, अगर आप उसको इंटरनेशनली देखें तो दिस इज अगेन बीइंग ट्राइड बाय डिफरेंट गवर्नमेंट्स. डिफरेंट कंट्रीज आर ट्राइंग इट इन अ कंट्रोल्ड फैशन वेयर दे वांट टू लर्न द एक्चुअल उसकी जो जिसको हम ये कहते हैं कि उसकी ability to tell us when the patient is infected and also the ability to tell us when the patient is not infected. उसको assess करने की जरूरत है. उसमें बहुत सारे चाइनीज आए थे जिनको फिर वो नहीं एक्सेप्ट किया गया. There is new kit that has come from Abbott. Again, the problem with that is अगर वो negative है, that does not mean कि आप कल positive नहीं हो जाएंगे. देखिए मसला ये है कि आज आप टेस्ट करा लें, आज आप नहीं है, लेकिन अगर आपका सही भी टेस्ट आ रहा है तो फिर उसके बाद इस बात का इम्कान कि कल आपको हो जाएगा वो हमेशा रहेगा. यहाँ पे फायदा सिर्फ एक जो एंटीबॉडी टेस्ट का है वो है कि अगर आईजीजी आपका पॉजिटिव आ जाता है, जिसमें 2 टाइप्स होते हैं, आईजीएम बताता है कि एक्यूट इन्फेक्शन है, आईजीजी बताता है कि आपको इन्फेक्शन हुआ था। आईजीजी अगर आपका पॉजिटिव हो जाता है तो फिर ये इस बात का इम्कान ज्यादा है कि आपको ये इन्फेक्शन हुआ और आप उससे क्लियर हो गए, और इस बात का भी इम्कान है कि आपको नहीं होगा। तो मैंने अपनी टॉक में कहा था कि व्हाट वी डोंट नो इज कि ये जो वायरस है ये एक दफा होने के बाद कितने दिन तक इम्यूनिटी हमें देता है, दैट इज समथिंग वी विल लर्न ओवर अ पीरियड ऑफ मे बी अ ईयर और approximately at least I think, and जब ये पता चलेगा तो ही हमें सही पता चलेगा कि इसकी जो ये टेस्ट की जो इफादियत क्या है। फिलहाल in short, do not get yourself tested if you have no symptoms, and if you haven't come in contact with agar aapko bahut pareshani hai, you come in contact with somebody, maybe you can make a case for that, or you've traveled from abroad.
So इसका मतलब ये हुआ कि अगर if I am in contact with people on a daily basis, if nothing is happening to me, so I should not get myself tested. And the other thing that you said which is positive is कि अगर IgG positive हो चुका है, यानी आपको एक दफा होके आप उससे survive कर चुके हैं, तो you are not susceptible. Obviously there are chances, but you are not susceptible anymore that you may have it again. So this is what I have gathered from
current information.
Yeah, based on the current. Yeah, that's
based on current infection. What we can say is immediately to nahi hoga, but how long will you be protected? We don't know.
Fair enough, fair enough. So another question from Asfar is कि वो ये कहते हैं कि economic conditions तो अपनी जगह है, लेकिन उनको ये डर है कि जो अभी गवर्नमेंट ने पॉलिसी लॉकडाउन को ईज करने के लिए अनाउंस की है, और जैसा आपने अपने टॉक में भी इसको डिस्कस किया था, तो वो ये कह रहे हैं कि क्या ये स्ट्रैटेजी सही है या ये बिल्कुल गलत हो गया है गवर्नमेंट से कि लॉकडाउन को हम ईज करने जा रहे हैं, जबकि अगर आप कल से आज तक केसेस में इजाफा देखें तो तकरीबन 1650 केसेस में कल से आज तक 24 आवर्स में इंक्रीज आया है. सो आर वी गोइंग और थिंकिंग एवरीथिंग रॉन्ग?
My view and purely medical view is yes. बिल्कुल गलत है, बिकॉज मैं आपसे यही तो कह रहा हूँ, गवर्नमेंट हमसे ये कह रही थी कि देखें जब आप नंबर्स को स्टेबलाइज होते देखते हैं ना, बाकी दुनिया की हम बात कर रहे हैं लॉकडाउन खुलने की, वहां नंबर्स अब स्टेबलाइज होने शुरू हो गए, डेथ्स जब हजारों से लेके अब नीचे आनी शुरू हो गई, इन्फेक्शंस के रेट्स कम होने शुरू हो गए निस्बतन, दैट्स व्हेन दे हैव स्टार्टेड टॉकिंग अबाउट लॉकडाउन. हमारे यहाँ तो मैंने आपको बताया कि जब हमने 2 वीक्स पहले वार्न किया था पब्लिक को, गवर्नमेंट को, तो उस वक्त से अब तक 3 टाइम्स बढ़ गया है. एंड अगर इसी तरह बढ़ता रहा और अब ये लॉकडाउन खुलने के बाद तो जाहिर है और बढ़ने का इम्कान है. एंड द एक्सपर्ट्स से दैट वंस वी ओपन द लॉकडाउन देन वी विल हिट द पीक sometime probably in the first week of June, and what that peak would be, it depends on, उसी पे डिपेंड करेगा कि हम उसको सस्टेन कर सकेंगे या नहीं. बट आई एग्री विद असफर कि ये सही नहीं.
कादर साहब, क्वेश्चन इज कि हर प्रोविंस जो है अपनी बात चला रहा है, फेडरेशन अपनी बात चला रही है, एंड देयर इज अ कांस्टेंट टसल बिटवीन एटलीस्ट फेडरेशन वर्सेस प्रोविंस ऑफ सिंध. सो अगर ये कॉन्फ्लिक्ट इसी तरीके से रहता है तो क्या डू यू सी दैट वी आर मूविंग टुवर्ड्स अ नेशनल गवर्नमेंट्स इन द कमिंग मंथ्स?
नहीं यार, वो आई डोंट थिंक सो. मेरे ख्याल कुछ हद तक I mean, it was sad what was going on, to some extent is still going on, but I think there is some kya kehna chahiye, sign of a consensus of some form, not the way you and I would have liked to have seen it, but at least इकट्ठे बैठे हैं. Unfortunately वो जो पिछले कुछ हफ्तों की जो रंजिशें हैं वो पूरी तरह खत्म तो नहीं हुई, बट कुछ हद तक चलो बैठ के कुछ चीजों पे फैसला किया, whether one agrees with them or not, कोई ज़्यादा बहस है इस वक्त. बट वो ये कि I think there is a beginning of what you and I would call a meeting of minds on some things. Whether अब देखें ना, confusing signal सिंध की तरफ से ये आए, CM की तरफ से कि जी we are all on the same page, साथ साथ ये भी अखबार की हद तक पढ़ रहा हूँ मैं कि जी हम मंडे के बाद देखेंगे क्या करना है. What it means I don't know. अच्छा, ये भी अजीब सी चीज है, टोटल कंफ्यूजन. हमें मिसाल के तौर पे कि आपने कहा कि जी सोशल डिस्टेंसिंग होनी चाहिए, बट जो है ना बार्बर वो खुल जाए. ये बार्बर में सोशल डिस्टेंसिंग कैसे होती है, जरा मुझे कुछ समझाएगा? मतलब है कि वो मुझे 6 फुट दूर खड़े होके मेरे बाल काटेगा. I'm trying to, I mean, I'm just confused.
That's my concern. I haven't had the haircut since last 2 months, and I'm afraid to go to the barber.
पोजीशन में हमारे यहाँ याद रखे, हमारे यहाँ पॉलिसी ऐसे बनती है कि वो दो सारे बैठे होते हैं, तो सीरियस किस्म के, हम सीरियस किस्म के लोग नहीं हैं, बैठे होते हैं, वो कहते हैं सर कमाल हो गई सर, मैं देखे इतने दिन हो गए अपना बाल नहीं कटाया, क्या किया जाए, ये खोलते हैं सर, ऐसी क्या बात है, वो खोलते हैं. किसी ने कहा होगा, तो किसी ने कहा होगा सर मेरी वो आजकल या वो जो मेरी बेस कोट को है सर, वो दर्जियों को कुछ खोल देना चाहिए. अब जाहिर है दर्जी खुद है, वो कहता है सर आपने दर्जी की तो खोल दिया, मैं कपड़ा कहाँ से आएगा. मैं मजाक नहीं कर रहा, मैं हमारे
I understand what you're saying, sir. It's correct. And
अगर आप अलाउ करें तो कैन आई ऐड?
Sure, sir. Please go ahead.
ये जो मसला है ना, ये जो बिल्कुल सही कहा काजी साहब ने कि न सिर्फ ये एक इसमें नॉन सीरियस एलिमेंट नजर आता है, दूसरा ये कि आप देखें ये भी मजाक है कि आप कह रहे हैं कि एसओपीज हमने बना दिए हैं, लेकिन एसओपीज पे अमल अवाम करेंगे. ये वो अवाम है जो जब तूफान आ रहा होता है तो लोग कहते हैं आप उस तरफ मत जाए, तो वो कहते हैं जरा देख तो ले वहां पे क्लाउड कैसे नजर आता है.
डॉक्टर साहब हम तमाशबीनों की कौम है, उसमें कोई दो
तो अब आप एक्चुअली, और जो सबसे बड़ा मेरा प्रॉब्लम, चाहे वो प्रोविंशियल फेडरल, कोई प्रॉब्लम ये है कि आप पहले ये बताएं कि ये सीरियस प्रॉब्लम है या नहीं है. एक सांस में आप कहते हैं सीरियस है, दूसरी सांस में गवर्नर साहब कहते हैं दिस इज नथिंग मोर देन अ फ्लू. Why are you sitting at home if it's just a flu? Who sits at home for 14 days in flu? So this confusion is actually not good for the sort of people we have in our country. वैसे ही बिल्कुल ही हम उस तरह के मस्त बवाली लोग हैं, उस पे आप उनको अगर कंफ्यूजन डाल देंगे, कुछ नहीं होता यार, ये तो ऐसी ही है, फ्लू है, तो उन्होंने वैसे ही कह दिया कि ठीक है सब खोल दो, सब कर दो. So this is, I think, one of the biggest criticisms I have against the government is that you've not been very clear yourself. The Prime Minister in the same speech says कि हो सकता है बढ़ जाए, हम strict lockdown कर देंगे, और उसी स्पीच में कहता है देखो कुछ होगा नहीं, इसको बस हिम्मत से लड़ लेंगे. So I think that's a big problem as well. Thank you.
देखें उसकी दिशा में जो कारोबारी लोग हैं उसमें would agree with me कि this has provided an opportunity for bureaucrats, police to make money. कि जी आप तो covered नहीं है, आप covered हैं, आप दुकान खोल सकते हैं, आप नहीं खोल सकते, आपने खोलनी है तो मुझे इतने पैसे देते. So rates have gone up, we all know this. वैसी बात नहीं कर रहा जो लोगों ने पूछा. मैं अच्छा मैंने अगर दुकान अपनी खोलनी भी है कुछ करने के लिए तो पीछे से जाके खोल लूंगा. हम सबको पता है क्या हो रहा है.
सर हमारे पास हांगकांग से क्वेश्चन है, सालिक साहब हैं, सिटी यूनिवर्सिटी ऑफ हांगकांग, ही इज फ्रॉम बैच 2015. वो ये कहते हैं कि लेट्स अस्यूम दैट द गवर्नमेंट स्ट्रेटजी to handle lockdown is wrong. Therefore, what approach would you suggest to enforce an effective lockdown, given that the economy is not worse off and the health conditions are not compromised as well? So, a tricky question for both of you, because वो ये कहते हैं कि lockdown भी हम आसान कर सकते हैं या नहीं कर सकते ताकि economy further वर्स ऑफ नाउ. प्राइम मिनिस्टर कह रहे हैं,
साहब कह रहे थे आप कराची में, हम तो फोटो में देखते हैं, लाहौर में भी, आपके यहाँ भी, कि मुझे अभी तक समझ नहीं आई लॉकडाउन हुआ कहाँ है, और लॉकडाउन में और आप कर रहे हैं. वो तो गरीब आदमी है, वो तो वहां तो कुछ नहीं लॉकडाउन छोड़. वो जो साहब कह रहे हैं कि भाई बेस्ड ऑन व्हाट वी सी एल्सवेयर, व्हाई एंड व्हेन इट विल पीक, फ्रैंकली वी हैव नो आइडिया. अभी अब आपके सामने अब दुकानें खुलनी शुरू हो गई, we will see. अच्छा हमारे यहाँ ये भी एक फैक्टर है कि जी टेस्टिंग नहीं हुई है, साहब को हमसे कहीं ज्यादा पता है. But then the other question mark is, अगर चलो जी टेस्टिंग नहीं हुई, पर ये तो फैक्ट है कि जी डेथ्स उतनी नहीं हुई. अच्छा अब मुझे नहीं पता कितने लोग ये पता चल रहा है कि यार ये कोरोना की वजह से डेथ हुई है या किसी और वजह से हुई है. आपको भी पता है कोरोना के साथ स्टिग्मा अटैच हो गया, आप वैसी बात नहीं कर रहा जो हम सबको नहीं पता. So this whole question of how you balance these things, frankly, are easier said than done. जो बाकी कौमों ने किया है, अच्छा वो पढ़ी लिखी कौमें हैं, मैच्योर कौमें हैं, उनको समझाया जा सकता है. यहाँ तो हर बंदे के लिए पुलिस वाला चाहिए उसको रोकना है. लेकिन हम तो उसकी
जज्बाती
सुनते
लोग हैं
हो,
बहुत ज्यादा,
हम ट्रैफिक लाइट पे तो मैं आप खड़े नहीं होते, ठीक है, और ट्रैफिक लाइट पे हर गाड़ी के लिए एक बंदा, एक पुलिस वाला चाहिए।
सर लेट्स गो टू द नेक्स्ट क्वेश्चन।
वही आदमी जो हांगकांग से आता है, वो जब इमिग्रेशन पे आता है तो लाइन में, हांगकांग जाता है तो लाइन में खड़ा होता है, वही साले साहब जब हांगकांग से कराची आएंगे इमिग्रेशन में लाइन में नहीं खड़े होंगे, हम तो
नहीं, I did stand in the line.
we are going to questions. Bilal साहब अपना question text कर दीजिए please. We cannot take the voice questions right now. Please text कर दीजिए. Thank you. Sir, please text कर दीजिए question so that we can take it. We cannot take the voice questions right now because we are short of time. यहाँ पे पूछा गया है कि जी if someone has severe COVID disease with pneumonic conditions, changes on X-ray chest, how much chances are there of the patient getting better? This is question for Dr. Saad Khalid.
Okay, this is a very difficult question because you need to know what other comorbids, i.e. blood pressure, heart disease, etc., age of the patient, all those factors have to be put in. Number one. Number two, obviously, we know this, that once you are ventilated, whether you are here or anywhere else in the world, there is a very small percentage of patients that actually come out of ventilator. So a significant percentage of patients actually don't make it. Unfortunately, there is no other option. So if the patient actually goes is actually ventilated, then the chances of them surviving are less than 50% at best.
Okay. Thank you, sir. There is another question. ये इसमें कहा है, ताहिर अहमद साहब का क्वेश्चन है कि should the government engage in infrastructure projects to boost construction rather than private construction?
अच्छा, वो उनकी बात में एक हद तक तो वजन है कि अगर कोई एक्टिविटी हो जाती है, forgetting for the moment the impact on people's health because of having an activity at this time, let's assume कि वो health वाला impact we all factored in, realized or taken the decision कि अगर कुछ cost है we'll bear it. So I won't go into that. But ताहिर साहब को ये मैं याद कराना चाहता हूँ, एक जानवर है called the IMF, जो वो कह रहा है कि अच्छे बच्चे ये काम नहीं करते, फिस्कल डेफिसिट और प्राइमरी डेफिसिट को आपने कंट्रोल में रखना है, उस बच्चे को कौन समझाएगा? मसला वहाँ है।
That's correct, sir. वो तो गवर्नमेंट जाके समझाएगी सर, प्राइम मिनिस्टर साहब जाएंगे और वो कोई जादू की झप्पी लगा देंगे तो IMF बच्चा समझ जाएगा।
नहीं, मैं तो आपको कह रहा हूँ इस वक्त जो पोजीशन है, मैं और वो अपना साथ बैठे, मुझे दो प्राइम मिनिस्टर साहब ने किसी और हवाले से बुलाया था, तो वहाँ पे ये बात हुई, तो मैंने उनको using साथ example as medical because I also sat on the Shaukhana board, तो मैंने कहा जी वहाँ पे जब कोई सर्जरी हो जाती है तो उसके बाद आप उसकी कीमो की एक प्रोटोकॉल होता है कि जी अगले 2 साल तुम्हारी कीमो रेगुलरली होगी। आप ये तो नहीं उसको किसी को कहते ना कि 1 साल कि मैं तुम्हारी सारी कीमो 1 महीने में कर दूंगा। मैं उनको ये समझा रहा था, मैंने कहा जी ये जो मसाइल हमारे हैं डॉक्यूमेंटेशन के ये पिछले 40-45 साल हमने झक मारा, मान लिया, पॉइंट इज मान लिया, एंड सो अगर सिम्प्टम्स ठीक कर ली जाए तो ये रातों रात तो नहीं अब ठीक हो। एंड द सेकंड पॉइंट इन दिस इज द अदर थिंग आई वांटेड टू से, कि देखिए प्राइम मिनिस्टर साहब को मैं यही कह रहा था कि जी आप क्रिकेट खेलते रहे, क्रिकेट में you don't only score runs, which is your tax revenues. There is also the other side, which you and I would say it is critical to win a match, you have to save runs. And save runs is the expenditure side. The expenditure side is the size of the government, even after the 18th Amendment. Just to let you know, there are 43 divisions. 43 divisions जिनका बजट 1.5 बिलियन से कम है। वजह बड़ी सिंपल है, शायद कारदार जॉइंट सेक्रेटरी है, वो सोचता है कि यार अगर ये डिवीजनें कम होगी तो मैं तो जॉइंट सेक्रेटरी रिटायर हो जाऊंगा। तो ब्यूरोक्रेसी का अपना इंसेंटिव स्ट्रक्चर, वो जो एमएलए इलेक्शन जीत के आया वो कहता है इसके मतलब मैं मिनिस्टर नहीं बनूंगा। सो वी हैव अ पॉलिटिकल इकोनॉमी व्हिच इज रियली क्रिएटिंग अ प्रॉब्लम। अब आप जाके रीनेगोशिएट कर सकते हैं तो कर लें। अच्छा, वो अब उसमें बड़ा साहब को खुश रखना भी बड़ा जरूरी है। वो जो हमारे चाचा जान है डोनाल्ड ट्रंप, उनको वो नाराज हो गए तो फिर एक और मसला है, बिकॉज विदाउट द अमेरिकन एंड द वेस्टर्न सपोर्ट इन द IMF board, frankly you won't get any. you can try and negotiate, but without their support in some, not just in voting terms, but also वो जो होता है ना कि यार वो साइड पे जाके कह दिए यार ये हमारा बच्चा है इसका ख्याल रखना, तो वो एक दफा कह दें कि जी हमारा बच्चा है इसका ख्याल रखना, तो फिर शायद थोड़ा सा टाइम मिल जाए. We really need time. Frankly, COVID-19 has made it much worse, and we need more time than this program is willing to give us.
Very well, sir. Point well taken. डॉक्टर साहब, ये जो हर रोज हम खबरें देखते हैं और ये जो बच्चों के साथ जो हमारे आजकल हो रहा है कि वो कोई और डिस्कशन नहीं होता कोविड-19 के अलावा, डोंट यू थिंक दैट इट हैज स्ट्रेस द एंटायर नेशन? हम लोग सब एक एंजाइटी के पेशेंट बनते जा रहे हैं, स्ट्रेस में आते चले जा रहे हैं, और खास तौर पे स्कूल के जो बच्चे हैं उनके ऊपर भी इसका इफेक्ट आ रहा है. एंड आई वाज वेरी ग्लैड टू लर्न just right now that Habib Public School is digitally engaging all these children, and they are looking after them not only by engaging them in physical exercises but also through DIY projects, music, art, and counseling, etc. So don't you think that as a nation there should be a very thought-provoked counseling sessions being organized by various segments or various walks of life, including schools like Habib Public School is doing?
I think that is, I mean, it's no-brainer. Absolutely, बिल्कुल होना चाहिए. और you are absolutely right. We are getting calls from school-going kids, के parents, के they have symptoms or they have problems which are obviously which have only started after this lockdown. And it has an effect. The disease itself has an effect, and obviously those who have any near or dear one who's had this problem obviously also has a big issue. For those 14 days, there's a lot of stress because you're worried कि कब तबीयत खुदा न खास्ता अचानक खराब हो जाए. And plus, obviously, you know, ये इस तरह की activities जैसी हबीब स्कूल की आपने कहा, I commend them for starting them, and I think every school should engage kids so that the kids ये जो एम्प्टीनेस है ना, ये आप अगर उनको ऑक्यूपाई कर लेंगे तो वो फिर इन चीजों के बारे में कम सोचेंगे. if they are not occupied, then they would start reading these things and start obviously doing things that they get boredom भी हो जाता है ना, which in itself is not good at this age, especially young kids, school going kids. ना बाहर निकल रहे हैं ना कुछ कर रहे हैं. So this is something that the world has actually never seen. At least we have never seen it in our lifetime or even heard of something like this. So it will have, and not only अभी जो हो रहा है, but I think बाद में भी इसके effects होंगे, बिल्कुल होंगे. Social and psychological effects दोनों इसका impact अच्छा खासा होगा. I think more in probably higher socioeconomic class than it would be in the lower socioeconomic class.
That's unfortunately सवालात बहुत सारे हैं.
मेरे पास एक सवाल आया हुआ है. अजीशान, किसी ने सवाल किया, मैं जवाब दे देता हूँ. very short answer.
Please sir, please.
कह रहे हैं कि जी our exports will be severely affected. What will happen to the balance payments? एक चीज मैं थोड़ी सी क्लियर कर दूं उस पे कि two things are also happening worldwide. Prices of commodities have fallen dramatically. आपने तेल की कीमत देखी. So it's not just what is happening, what will happen to exports. The import side, which is commodity prices, oil, वगैरह, have also fallen sharply. So yes, we are also going to be hit by remittances. Our own estimates are between 20% to 30% remittances decline होंगे. But because the fall in those prices globally will also benefit us. And second, इसमें जो है उनके सवाल का अगला हिस्सा है, अच्छा भी what will we be able to manage? मैं ये कह रहा हूँ कि एक तो ये है कि वो prices globally have fallen. Secondly, because of some freedom on relaxation of our debt servicing for the time being, plus some inflows from World Bank, additional inflows from World Bank, ADB और IMF से आया है, ये साल मेरे हिसाब से will actually be okay. So the answer to your question, Riaz sahab, is that we will manage. The problem will come next year if the economy starts picking up. One of the things which is happening today as well is not just because prices have fallen, because if the economy is not really functioning, तो वो demand imports के लिए भी नहीं है ना. So the external account पे जो pressures हैं, stresses हैं, वो उस तरह के नहीं है. When the economy begins to recover, then we might stand. The rescheduling is not over a much longer period, then we could face the kind of stresses for next year.
Thank you very much, sir. I'll take that Pakistan as a blessing in disguise overall, because all the cost of production will go down, and there is something which may we get benefit of. Thank you so much. आप लोगों ने सब लोगों ने join किया. This was the first ever Zoom meeting, Speakers Corners, that we conducted. On behalf of the entire Executive Committee of Alumni Association, I'd like to place thanks to the school management, to the school who participated in this meeting. I'd also like to request you all to please keep visiting our Facebook page. This is first of many meetings.
I have a question for Dr. Saad.
Sir, this is our time. Unfortunately, our time is over. Can you just text me or text on this forum, and I'll get your answer reply to you, because we are over. Time is over, sir. मैंने request भी किया था कि आप उसको text कर देंगे तो हम जवाब दे देंगे. This is first of many Zoom meetings that we are going to have it, because I think this is the new normal that everyone should adopt. And I think ये informative program था. We'll try to get इसके अगर हमारे पास हमने कोशिश की है session को record करने की. अगर वो session properly record हुआ होगा तो we'll put it on the Facebook also and our website also. Once again, on behalf of the entire association, myself, I'd like to thank the speakers for taking so much of their precious time and joining us today. And today, I think हम सब यहाँ से educated, well informed, और कुछ खतरे, कुछ issues साथ लेके जा रहे हैं, लेकिन बहुत सारी clarity भी अपने साथ लेके जा रहे हैं. So thank you once again for being there with us, and we look forward to see you in the next Speakers Corner. This is Nishan Merchant signing off. Thank you.